If you have a large or giant breed dog, hip dysplasia is one of the conditions your vet is going to bring up. And for good reason. It's common, it's progressive, and catching it earlier makes a real difference in how your dog's life plans out. Hi, I'm Lyndall from Vetster. Today we're covering hip dysplasia in dogs, what it is, what to look for, and what actually helps. Alright, let's get into it.
Hip dysplasia is an inherited condition where the hip joint doesn't develop correctly. Instead of fitting snugly together, the ball and socket are too loose. That instability causes abnormal wear on the joint over time, eventually leading to osteoarthritis. It's most common in large and giant breeds, but it's not just genetics at work. Obesity, lack of appropriate exercise, overnutrition, and growing too fast as a puppy can all contribute. So management during the puppy stage actually matters. Here's something important to understand. Hip dysplasia often doesn't show signs until joint damage has already built up. A dog can have it and seem completely fine for a long time. That's why screening matters for at-risk breeds. X-rays can be taken as early as 16 weeks. In some cases, puppies as young as 10 weeks can be diagnosed. When symptoms do appear, the first thing many owners notice is a bunny hop gait, where the dog moves both rear legs together rather than alternating. As arthritis progresses, you might see limping, stiffness when getting up, reluctance to jump or climb stairs, reduced range of motion in the hips, muscle loss in the rear legs, or pain when the hips are touched. Some of these signs also appear with other conditions like a torn cruciate ligament, luxating patella, limb fractures, or bone cancer, so your vet will need to confirm the diagnosis with imaging. Home care is about reducing inflammation, maintaining mobility, and protecting the joint. Low-impact exercise is key. Short, consistent walks, swimming if your dog enjoys it, and an underwater treadmill if you have access to one. Stretching and massage can help too. Maintaining a healthy weight is one of the most effective things you can do. Even a small amount of extra weight significantly increases pressure on the hip joints. Joint supplements like glucosamine and omega-3 fatty acids have limited evidence for reversing damage, but they may help slow it and support long-term joint health. Talk to your vet before adding them. Never give human pain medication. Many are toxic to dogs. Your vet can prescribe NSAIDs specifically for dogs. Treatment options vary by stage. Mild to moderate cases are typically managed with anti-inflammatory medications, physical therapy, and weight control. Physical therapy options include laser therapy, shockwave therapy, underwater treadmill, and acupuncture. Surgery is the only way to correct the underlying joint laxity, and it's most effective before arthritis sets in. Options include joint preservation procedures for young dogs, FHO for dogs with severe arthritis, or total hip replacement. Surgery isn't right for every dog, and your vet can help you understand what's appropriate for your situation. See a vet if your large breed dog shows any changes in gait, struggles to get up, seems sore after exercise, or if you have a puppy from a breed with high rates of hip dysplasia. Early diagnosis gives you the most options. If you're worried about your pet, you can book a licensed vet online at Vetster right now, day or night. Thanks for watching, and we'll see you in the next video.